had a wine spill in here yet.
And we're not going to today. Cheers to no wine spill.
Cheers to no wine spill. Welcome to Adultish Wines.
Thank you.
Dr. Mamawah Bourque.
Yes.
Is that how you say it?
You said it perfectly.
Did I?
You did. Without even like a hesitation. I love it.
Dr. Bourque.
Yes.
Wow. Okay, I'm so excited to have you.
Thank you. We didn't sip.
Oh, shoot. Is that's 6 or 7 years?
Honestly, I don't know.
What's that thing?
Is that what they say? I just know I always forget to sip.
If you don't look in the eyes when you cheers, I think it's bad 6 or 7 years.
Oh. Well, we already looked in
We already looked in each other's eyes, and you're here to help us with
yes.
6, actually, which we'll be talking
So, two reasons why we'll not have bad sex.
Exactly. I feel excited about that. Okay, so I reached out to you because, for a few reasons. One, I saw you on the Nightcap.
Mm-hmm.
I loved, saw a couple of your episodes. I was like, oh, we've got to find out about that.
Oh.
But another reason was because I had my physical therapist on as a guest probably 30 episodes ago. I had a hip surgery and he was on. He's, I would say, a friend of mine at this point. We ended up playing volleyball together and are friendly. But he was talking about like what's really known, people need to know about it, is pelvic floor therapy. And so, when you hear something and then, or like you don't know how to spell a word and then you continue seeing it forever and ever. That's kind of what happened. So after he brought up pelvic floor therapy, I felt like I just started seeing more of it. Maybe it's the phone listening or whatnot.
Yes.
But that's why I was like, people need to know about this.
I agree.
For so many reasons, and I'm excited to get into. But first, I kind of want to know a little bit more about yourself personally. Who are you before we go into pelvic floor?
Yeah. So thank you for having me. First of all, I'm really excited to be here and love your show because I do watch your content. So I'm really excited to be here.
Thanks.
So thanks for inviting me. And yes, again, like you said, Mamawah Bourque. I am a person who loves life, and I try to love life. I try very hard not to talk about like who I am, what I do, but all the hats we wear. But that's the root foundation of me. Okay. I have 3 kids. Okay. Almost 14. No, I have a 14-year-old. An almost high schooler, which is crazy.
Okay, the 14-year-old is the almost high schooler. Okay.
And then I have a 9-year-old. So. And then a little girl. She's 6. Okay. So I have 2 boys and a little girl.
2 boys.
I have been married for 15 years.
Okay.
To my husband, Justin. And he is fantastic and super supportive, which is great. I'm a native Houstonian.
Okay,
I don't think you run into a lot of Houstonians.
I'm not. And I never pretend to be, for the record.
You have to even though we know Houston, love Houston, ride and die for Houston. There's a lot of things about Houston that's really annoying. But if you ever talk to a Houstonian, we will absolutely be like best place ever.
Right. And the thing is like with all the bad weather and things like that, like I just never want to be the first person to talk shit or be upset about Houston, because the greatest comeback you can ever give me is like, you moved here.
Yeah, you're here though.
Yeah, thanks for coming. See you later. Actually, I've never people have been very kind. Like I tell people like I'm from LA, and people will be like, it's fine. You know? But you see on social media like turn around, Houston's full, don't come here. Don't come.
Yeah. I never say that. I was like, welcome.
Okay.
You're great.
Okay, good.
Yeah. So I was born and raised here. My family's from Sierra Leone, West Africa.
Okay.
And so I'm Sierra Leonean, or we say Salon.
Sierra Leone.
Wow. But I was born and raised here in Houston. Okay. So.
And then I complimented you on your perfume when you walked in. You said your husband got it for you. And I was impressed. Because, obviously, I don't know what your taste is. Maybe you don't like it. But I was like, you smell really good.
Thank you. I'm not really great with smells. I don't know if it's since after COVID.
Did you lose your smell?
I did.
Me too. Taste?
And taste.
Me too.
I didn't have any of. I was one of those did you get COVID early in?
I got it July of 2021.
Okay.
So I guess a year
ish after. Into it. Okay, I got it November.
Okay.
Because I worked in the hospital at that time, and there was multiple people during that time that all got it, and I just happened to be one of them. And I was like, oh my god, I hope I don't Because that's when everyone was either
very scared,
dying, hospital, and I lost smell and taste. And I just feel like my scent's been different. But he did a really good job of picking. He does really great at picking fragrances. Like he's always on point with his
That's so nice.
Scents.
You hear a lot of like boyfriends or husbands don't do the best gift giving. And I don't know if it's because they don't pay attention or they have bad taste in some things. Obviously, it's very dependent on the person, but do you ever give him tips or he just...
I hit the jackpot on husbands. I'm just not that thoughtful like him. He's way more thoughtful than...
I love that you recognize that you're like, I'm not that thoughtful.
No, I'm not. I try, I do, but I'm not.
What's your strong like love language that you give?
Yeah, I think
if it's not acts of service,
I do think it is acts of service.
Okay,
it's less like, oh, I thought about the fact that you were out of your favorite whiskey. Let me go get it. It's more like, I'm cooking. The house is clean. Let's all go out to go do something. I like time.
Yeah. Okay.
Quality time. Mm-hmm. I think that would be that would be more my style. I'm not very touchy-feely either. Okay. So I feel like a terrible person.
Oh my God, no. Everyone has different styles.
Yeah, I'm not very touchy-feely, but I am touchy-feely, but I don't.
Not always.
I'm not always touchy-feely. Maybe it's because I'm a PT and I have to be very touchy all the time. Right. But then, like, for instance, I don't like massages. Please do not massage me.
You don't go get a massage? You don't pay
unless
somebody?
I have to, because something hurts and I can't reach the thing.
Okay.
But other than that,
you will not go because, like, you're gonna feel good after.
No.
Whoa.
I'm a busybody. I just don't like to slow down.
Okay.
So a lot of times, like, things where I have to, like, sit or sit still don't feel as natural.
Interesting. All right. Just wanted to kind of hear a couple little tidbits about you. Get to know you.
Thank you for that.
You're welcome.
I didn't really reflect like that.
Well, I know, and I just feel like we're going to be talking, obviously, about your job a lot, but I try, like, even in meeting people in real life, I try to not ask them, what do you do for work? What do you do for work? As, like, a top 3 question.
Yeah.
Because I just feel like that doesn't really define, in most cases, it doesn't really define the person.
I like that you do that. Because honestly, if you were to have not done that, I probably would have been like, hi, my name's Mamawah.
Right.
I'm a pelvic PT.
And you are. And that's such a big thing about you. Obviously, we're going to talk about it. And that's the main part of this episode. And I'm so excited to learn more. And I know that my listeners are too. But I was like, well, who's the person behind?
I'm a mom. I'm a sister.
Okay. Yeah. Of how many?
I have 3 siblings.
Okay.
I have
youngest, oldest.
I'm the oldest. Everybody else is younger than me.
You said it with your chest.
I'm
the oldest.
I am the oldest.
I'm one of 4 as well.
Oh.
I am the youngest.
Okay.
So I was the golden child.
You didn't say it with your chest.
I don't need to.
That's us that have to do that.
I don't have anything to prove.
I love it. Oh, that's so funny.
Get what I asked for.
You're like,
just kidding.
It is. I am the child. Okay, I am the one.
The only one. No, I am. Yes, I am the youngest. I was the golden child. Yeah, I don't know.
Are all your siblings in LA?
One is in Washington State still.
Okay.
We are all born in Los Angeles, California. My grandparents were from Washington State, so we spent some time up there. So one met her current boyfriend and father to her 2 children. Mm-hmm. I guess you just call that a partner, eh?
Yeah.
Like I'm Canadian. So they're in Washington still, and then my other 2 sisters are in Southern California.
Nice.
And I just moved to Houston. I had to get the hell out.
Why?
Just try something new.
What are your name 2 of your favorite things and 1 of your least favorite things about Houston?
Okay, I'm not a negative Nancy, but I immediately have 2 negative things. Okay. And I really like it here.
Okay, my
2 negative things are nobody. So I'm from Los Angeles where like the 405, you're going 3 miles, it takes you an hour. Like we get it.
Yeah.
But people are moving with a sense of urgency. everyone has to be somewhere.
Mm-hmm.
And it's not like that on these freeways here in Houston. There is traffic, but there is so much room in between all these cars. And I'm not encouraging like the bob and weave, but if we all kept up with each other, the traffic would be lower.
Okay.
At times.
That's interesting. I've never heard that perspective. Maybe it's because you're from LA.
I think, and it's
like
just
busy, like it's you're used to the busy.
I'm used to the busy. I'm used to the traffic. That's fine.
Yeah.
But I get frustrated when there's no need for traffic. Why are we going 35 miles an hour on the freeway?
Okay.
When there's so much room ahead of us.
I hear you.
And like, even if you don't have to be somewhere quickly, I think that's just LA culture where like, you gotta go.
Mm-hmm.
So that bothers me. And then the other thing is I used to hike frequently and there's no mountains here. So that's like the one thing I do miss about California.
Okay.
But I love the food here.
Okay.
I love the diversity here.
Okay.
LA was very diverse, but there's just more of it here, which I love to see. And I think that comes through in all different areas. The food, the music scene, just like the different neighborhoods. I love that.
Yeah.
I feel at home here.
I love that.
People have been so kind. Like I said, no one's ever said to me. One guy at Target was rude when I asked where the alcohol was. And he's like, we don't sell alcohol here. Where are you from? And I was like, just at the liquor store.
But they do. Go. Oh, you mean like wine and whiskey and okay.
Yeah. No, I love it here. I'm happy.
I'm glad.
Thank you.
Because Houston is great. It is home.
It is.
It is great.
Yeah, it's just a homey feel. And I've really, truly, like, made some really good friends that are now just like family.
Your family.
Yeah. But it was a nice little start over chance that I got. Just try something new.
Well, I'm glad you did it.
Thank you.
We connected because of it.
Connected. Oh, my God.
What? You didn't turn on your...
We're going to continue, and this is staying in, but can you even believe I just said earlier, we're keeping... Oh, my gosh. Hold on. Sit tight.
Okay.
It's going to take 2 seconds. I was like, why is my face not hot? It normally is hot.
First of all, that just shows how much we were into the conversation.
I guess so. Oh my God, I can't even believe that.
Is that the first time you've done that?
Yes.
Really?
It's okay. We're here now. That's fine. It's a good segue into. Okay, so you have over 13 years of experience in the physical therapy industry. Is that right?
That's correct.
Okay. I obviously want to know your background there and how you decided to end up coming over to pelvic floor therapist. And then I have so many questions.
Oh, man. Okay. So, again, 13 years of experience. I worked in almost every setting you could imagine. I'm talking trauma at the level 1 trauma centers in Dallas. I worked in Dallas first.
Okay.
I worked in burn unit. I worked with peds. Very little bit of peds. I'm not a big fan of peds. It's just emotionally too much for me.
Wow. I wonder what kind of person can do that.
Oh, they're
strong.
Fantastic pediatric peds. I just don't know how they can do it either. It's either one or two things for me. I either don't like peds because it's emotionally, or a good friend of mine used to say she didn't play because she flunked recess. And I totally get what she is talking about because like, I'm not really like, like I don't I don't really do well with like kid talk. Like, right. I mean, I can with my kids because I know them. Right. But other people's kids, I get really awkward. It's the weirdest thing. I'm like, hi.
That is funny.
Yeah.
And you're like, wash your hands.
Yeah. I'm like, I know that like for kids, they're just messy and I'm like, that can, but I don't interact really well with other people's kids, in my opinion. But
okay.
Yeah. So a little bit of peds. Worked in outpatient, but I love neuro.
Okay.
Neuro is my jam. I'm talking head. It is brain. It is spinal cord. It is autoimmune disorder like multiple sclerosis, ALS, vestibular stuff. So I really I love the brain. Okay. I love the synapses that happen with nerves and how they crisscross and how it is incredible. Like when you really break down the nervous system, it's like, it's life.
I think I could be studied. My body, we've been through it.
Oh.
I have.
In what way? Oh, because,
so
first
many
the
ways.
surgery.
I had a hip surgery. So I had a torn labrum.
Okay.
And, oh my God, torn labrum and hip impingement.
Okay.
So that was about 1.5 years ago. I had torn ligaments and tendons in my left ankle.
Okay.
What's the one that heals itself?
Tendons? No, I mean
ligaments.
Ligaments heal.
So they went in to repair the tendon, and I had an extra tendon.
Oh.
Which was causing all the swelling.
Like a surprise one that wasn't supposed to be there.
Right. And the doctor was like, and I took it out because that was why your foot was constantly hurting. And you had a torn one as well. But anyway, it was too much in there. I had a wisdom tooth surgery and I'm still numb from it over 2.5 years ago.
Oh, wow.
My nerves. When you said nerves, how they all move together. So I was like, I could be studied. Yeah. I'm a mess.
Yeah. Oh, well, you're not. I said, yeah, but no, you're not a mess.
I am. But okay. So, maybe you can have some diagnosis.
Yeah. I'm really intrigued by this nerve part on the wisdom tooth. I love neuro. Orthopedics is basically, I would say, is a real big, strong foundation in PT.
Okay.
So I feel like any therapist, for the most part, could be really good in like giving you general ortho, but then you really need to like know it. There's some really, can I say badass?
Yeah.
Badass orthopedic providers. I don't know that I would be that.
Okay.
But I can appreciate that. Okay. But I would say I'm a badass pelvic PT and I'm a badass neuro PT.
Yes. Love it.
Yeah. So I loved neuro and worked in clinical and then transitioned to admin. And now administrative work. So I had a team. I was responsible for a team. I worked here in Houston at the VA for a long time, like 9+ years, and loved it, but quickly moved from clinical work to administrative work.
Okay.
So although I did some clinical, I also did a lot more admin, and that admin hat just kept getting heavier and heavier. And I felt like my light was getting dimmer and dimmer.
You wanted to be kind of in the action.
Yes. Yeah. And I felt like I left the action way too soon.
Okay.
And again, that COVID bug, around that time, I started really leaning into, okay, maybe I just need a pivot. I need a pivot. However, I actually was also trying to hire a pelvic PT in my facility for years. Okay. And every time I'd be like, I should just go do it now. Because my professor used to call me all the time and be like, why won't you just go ahead and do it now? But I was like, no, just had a kid. No, I'm in admin. No.
You're never going to be ready.
Right?
Yeah.
And once I had a really hard time hiring, I just finally was like, I'm just going to do it. So I went back for a year in school, and the first semester of it, the first class I took, I was like, this is incredible. Like, who knew? I've been a PT how many years now? Who knew that the body really moved this way? And in that moment, I was like, there's a whole aspect of PT, and many PTs don't even know that their bodies do that because they didn't teach it whenever I was in PT school. Maybe had a class and the focus was on pregnancy and postpartum. But other than that, like that was the last you really heard of it. Okay. And so leaning into that, I just was like, okay, this is it. Like I immediately knew like, this is where I need to be. And I've never looked back.
Wow. And so how long were you doing it before you opened your own practice, right? Because Awareness Pelvic Health. Okay.
So I was practicing for about, I want to say a year before, like actively doing pelvic PT for a year. And then I met with Viviana because we had a mutual friend. Okay. And she was like, oh my gosh, I would just love to work with a pelvic therapist. And at that point, I did pelvic all day, every day. Like I put down all the other hats and it was either admin or pelvic because I wanted to grow it because there were so many veterans that didn't have access to that care, and between military sexual trauma, between post PTSD for
Are you a veteran?
I'm not a veteran.
Okay.
But they have a very special place in my heart. All that they've gone through.
Yeah.
It's just, there's so many impacts that people are not, maybe not connecting with how much stress people carry in their pelvis and how that impacts their life, from sexual dysfunction, from erectile dysfunction, from incontinence, even the female veterans or the that are pregnant, or veterans that are transgender, or, there's just not a lot of support for the minority veterans, meaning like not necessarily just gender, sexual orientation, all the things. And so I just wanted a safe space for them to have that. And I, even though I felt like my light was dimming in my current role, and I was wearing an extra hat just to be able to create that space.
Right.
So I felt burnt out really quickly.
Yeah, I can imagine.
Yeah. And then with my son turning 13 or something like that, I think, was it 13? 12? Or going from 12 to 13 or something like that. I just was like, the next couple of years are going to go by so fast. And I will be like, why are you working this hard? I'm still working that hard, but I'm working the way I want to now.
And you're building your own business from the ground up, and you're really helping people.
Exactly. Daily. So I still get to do what I love to do, which is serve the community, whether it's Houston community. Right now it's the Houston community. It used to be the veterans. Before that, it used to be the underserved.
That's really cool.
Yeah. So now it's the Houston community, and Houston's amazing. Like, we have great people, and they just want to heal and have quality care. And I was hell-bent on creating a space for that.
Don't we all? Just quality care.
Quality care.
And not go broke, hopefully.
Yeah, that part too. It's ridiculous.
It's so bad.
Yeah, it is.
It's so bad.
Not go broke while you do it. I know. That's kind of how I ended up there, connected with Viviana and Dr. Viviana.
Dr. Viviana?
Yeah, Dr. Viviana.
Who has been on the pod.
Yes.
Oh, she will have just been on last week by the time this episode comes out.
Okay. Yeah.
You're like, that doesn't add up. What do you mean? Okay, so let's start with when I first heard about pelvic floor. I do think I heard about it a while ago before my physical therapist brought it up. And to me, all I thought was do Kegels.
Yeah.
That's what I thought my pelvic floor needed. You know?
That's
so
common.
I don't know if that's like a misconception or it's just like an early, like, dive deeper, girlfriend.
Yeah.
You know? Or boyfriend.
Yeah.
You know?
So I would say, first and foremost, that is the biggest misconception, because that's what everybody thinks. Do Kegels. First of all, Kegel, I believe his name was Dr. Kegel. I don't remember, but it was named after a man, right? That said, oh, okay, well, these contractions are great to do because then you get stronger in your pelvic floor. But the truth of the matter is the pelvic floor is a muscle just like our arm. And so, like the muscles in our arm, they need to be able to move up and they need to be able to move down. And when you do Kegels and you focus on the Kegels, nobody ever focuses on the point that those muscles still need to move down. So, and most of my patients, honestly, if you ask most PTs, they're going to be like, yep. Pelvic PTs, they'll probably be like, yeah, we mostly train how to make those muscles go down. And the reason why is because if the muscles don't go down, then there's an increase in kink on the pee hole. I'll just say for layman's terms, the hole that pee comes out of. There's a kink. If you think of a garden hose, right? When you put your foot on the garden hose, and let's just say you turn on the water and it doesn't go out because you push your foot on it. The pelvic floor acts like your foot on a garden hose in some cases. And so sometimes people they don't fully empty their bladder. So they go to the bathroom over and over and over and over and over again. Like they're like, oh my God, I have to pee every hour or every 30 minutes. And I don't know, I can't go on trips because I'm not going to sit in the car that long. I can't take a flight. I'm going to I have to pee every time, like all the time. Or they leak because they can't put the kink on the tube.
Interesting.
Right? Or they don't have good pressure mechanics. So they sneeze and they pee, or they jump and they pee because they're not putting the kink on the tube at the right time.
So when I feel like I've heard people say like, "Oh, I've had too many babies. I sneeze I pee when I sneeze."
Yeah. It doesn't have to be that way.
You need to strengthen your pelvic floor,
or you need to learn how to coordinate it at the right time. I have so many patients that whenever I teach them that mechanic to, like, great example. Let's try it together. It's going to be a little great.
Oh, okay.
Okay. We're not going to get up,
okay.
but let's just try it together. So pull up your pelvic floor.
Okay.
Okay. Can you like do a Kegel?
Yeah.
Now let that Kegel go. Can you let the Kegel go? Did you let it go? You don't? Okay.
I did late.
Okay. It's all right. It's down now.
Yeah.
All right. Now just cough. Okay. Now, this time do a Kegel and then cough.
At the same time?
Yeah. What your pelvis, does it feel more tight when you cough the second time, or did it feel like? Or is it hard to say?
It's hard to say.
Yeah. Well, this is because nobody really pays attention to those
Yeah.
muscles. So it's like foreign, like I don't know when it's up, it's down. But your arm, you know when it's up and down, right?
Right.
So I teach people when to know when it's up and down so that they don't have that issue. So if I were to teach somebody to stop leaking when they sneeze, laugh, cough, jump, I would train them how to pull it up before you sneeze, laugh, cough, jump, using the right techniques, using the right muscle groups, and they'll pretty quickly, in most cases, stop that problem. Right. They'll be like, oh my God, it doesn't happen anymore.
Does it stay it's a pretty conscious thing that somebody has to do? Or you just...
Oh, eventually it becomes like walking,
right,
where you just know what to do at the right time. So we're a little bit different than your traditional therapy in that, you know, we're giving you a toolbox because a lot of the things we do are habitual. Like they're things that people do on a daily basis that they don't even realize that they're doing. And then we bring your attention to it, teach you how to correct it, and then say, okay, now you know how to do it. And then you start doing it in your daily living activities. You're going to pick up your baby, you do the right mechanics, and then you pick up your baby. Now you're lifting things and not leaking. Or you're at the gym and you're doing squats, you pull up your pelvic floor at the right time before you do the action, and then you're not leaking.
Wow. Yeah.
So we are like mechanics to the muscles in the vagina and in the rectum, depending on who you're seeing.
Okay, so what are some top things besides the leaking, or the leaking while sneezing or something like that, or constant peeing, right? Because you said you're not letting it all out
when you go pee.
What are some other like possible scenarios where you should look into pelvic floor therapy?
Oh, such a good question. All right, there's so many things.
Yeah.
I mean, honestly, if you're a human, you should see a pelvic PT, in my opinion, first of all.
Really?
I truly believe that. Because there's a problem with you, or there's something has to be wrong. Many of the things we work on, people don't even, they identify with it as being a them thing. Like they're like, oh, I've always been this way. Oh, I never used to poop when I was a kid. I had the hardest time pooping. Always had the hardest time pooping.
Wait, so people that have poop problems,
oh yes,
probably
should see
would benefit.
If you're constipated all the time, if you only go to the bathroom 1 or 2 times, and when you go, it's really difficult to go.
Who go to the bathroom once or twice a week only.
Yeah, they should probably go see a pelvic PT. Because there's so many aspects of things that impact it. And I can't tell you how many times I talk to a patient and they're like, oh no, I've always been that. I mean, I only go 1 or twice a week, but I've always been that way. And they just identified it, that's who they are. Right. But really, it could be a mechanics
issue. You could live a better life.
Yes, exactly. And they don't know it. So that's why I say if you're a human, you should go see one. Another thing is pain with sex. Like historically speaking, people say, grab a glass of wine, you'll make it better, right?
Right. Yeah, that'll ease the discomfort.
But it's not true. I mean, yeah, maybe it would, but it's more like a disconnect and not a connect. Nobody really just wants to drink wine just to have sex. I mean, you'll never remember it in some cases.
Can I tell you, and this is kind of on topic but kind of off, is, and this is a lot of information. I am an open book, but this might be a little much. I just had sex for the first time with a new partner, 100% sober, I think in my whole life.
Wow. That's the first time?
I'm 34.
Wow.
I was about to have a surgery, so I couldn't drink alcohol.
Oh.
So I had gone on dates and wasn't drinking.
And how connected did you feel with
it was such an intimate connection. And he didn't drink either because he knew I wasn't, and which was like such a, I thought, gentleman thing to do.
Yeah.
But the connection was so good, but I didn't feel like I did my best. I didn't feel like I did my best.
Oh.
In the moment.
So, that's really interesting that you say that. You know why?
Why? Tell me.
Because I feel like many people do not connect with their body and knowing how to find their pleasure.
Yeah.
Because either the one, historically speaking, women's health, people with the uterus, they traditionally have always been known as the people that, like, your sex life doesn't matter, right? So historically, we've always thought, this is weird. I don't want to talk about it. You don't talk about it. Some people, like you said, you're an open book, are more open to it. Even me, like, ask anybody that knows me personally, they'd be like, oh my gosh, she's such a prude. She won't talk about anything about her sex life.
I love it. That's fine. Some things are sacred, not me.
Right? So every time, like, even when I'm on the nightcap and they're like, talking about things, I'm always like, nope, I'm not doing it. But,
Oh, no, they call me for those ones.
What?
They call me for those topics.
Oh, I see.
They're like, we're getting into it tonight.
Yeah.
I'll be there.
For me, I'm always like, oh, I just came to give you the information, which is one of the reasons why I got into pelvic. And this might be, this is the most I've ever talked about my sex life. So,
okay, well, don't do anything you're not comfortable with.
No, I'm not. But I think one of the reasons why I was very attracted to the pelvic health space is because historically speaking, like, intimacy has never just come natural to me for, I don't know all the reasons behind it, but talking about it made me very uncomfortable, which is why I reached out to Viviana, because when I started pelvic initially, I was like, I don't know why, but I get really uncomfortable anytime people start explaining their sex life to me. And this is my role. Like, I'm supposed to help you get better. I know what to do, but the words felt awkward to me. And it really was a journey for me to make it to where I can say masturbation and, okay, well, what did you use? Did you use your fingers? Did you use a toy?
Because that's important information for you.
Exactly.
And they need to feel comfortable telling you.
Yeah. So back to you. I don't know why I did that, but
no, that's good.
I feel like a lot of times that when people don't, when there's alcohol involved, your what do you call those that region, like your the places where you kind of let go of your inhibitions. Yeah. You let go and completely. You allow your body to just be free. And when you take away the alcohol, you just increase the sobriety. Now you have to connect in a way that, how do I find those inhibitions?
Yeah.
Yeah. So that's another reason why somebody should go see pelvic PT.
Interesting.
Because then we talk about, like, this is your clitoris.
Right.
This is how you stimulate your clitoris. This is your G-spot. This is your vulva, and maybe exploring different things, different sensations. There's also people who every time they have sex, their vaginal opening kind of narrows or closes, or even the muscles are just tight. That's called vaginismus. Have you heard of vaginismus?
No.
Ooh, man, we could be here forever. Yeah, vaginismus is like people that can't have or have difficulty with penetrative sex, or they can't at all because they are not able to even insert even like their pinky.
Really?
Yeah. Or people that are virgins and they've never experienced and they attempt and it's like, or they've been told something all their life or
Right.
Religious reasons why they have a relationship, their relationship with sex might be skewed because of their beliefs. And so they have a hard time like navigating. This is now the time for me to do this, but I've always felt this way. And now I can't.
Right.
It's or they're just so disconnected from that system. They don't know what to do. Pelvic PT or pain with sex every time they attempt. Men having pain after ejaculation, or they get like really sore in their muscles, or pelvic pain to tip of the penis pain. Anal fissures.
What's that?
That's like, okay, if you think of like, you get a crack on your mouth, like hair, like if it's like,
ow,
on their rectum.
Oh,
and so like cracked. And then every time they poop, it's like they re-cracked that scab and it's really painful and then they guard their pelvic floor and the pelvic floor muscles won't let go.
Ow.
Yeah. There's so many things out there. People don't talk about these things.
I didn't know.
Yeah. There's
not enough people know this.
Yeah. Pregnancy prep to reduce the risk of tearing. After birth, C-section scars that are painful for years after. I had a patient the other week, like I'd only seen them 3 times and they're like, oh my God, my scar doesn't hurt anymore. But before she was like, I can't even go back to the gym. It's so painful.
Yeah.
And then like 3 sessions, she was like.
I do know people that have talked about just like the pain. From that scar. Like even like a legging.
Yeah, being irritating.
Yeah.
And it could get better. And they don't send you to, not every provider goes, it's a must. But in my opinion, it should be a must for anybody. Mm-hmm. The transgender community, the people that are having gender affirming surgeries. Like there's not enough care for that community either. So it's a space that could really benefit from understanding or having access, because not every therapist would even treat or feel knowledgeable, competent. And so that then draws them away from it because you're like, this is something, everybody has a pelvic floor.
Right.
Every human has a pelvic floor and you should know how to use it.
Well, every human has a pelvis. Is that right?
Yes, exactly.
Okay.
Every human has a pelvis.
Anatomy is matching up. Okay. And the pelvis is technically, like, I know where my pubic bone is.
Yeah, that's your pelvis.
Is that my pelvis?
Mm-hmm. Your hip.
Is that crazy that I don't even know that? Like, I'm questioning.
It's not crazy. It's common, but it's unfortunate, but it's the truth.
Yeah.
It's not strange. It's definitely very common. I'm one of
many.
Yeah, you're one of many.
Okay, so my pubic bone, that's my pelvis.
That's your pelvic bone.
Uh-huh.
Mm-hmm. And then your hips attached to your pelvis, and you have muscles that live inside your pelvic floor that could impact how your hip moves.
Let's talk about my hips.
Okay.
So I had the surgery.
Uh-huh.
And I was told, like, really don't do so much stretching immediately after, like kind of wait on that. And this is 1.5 years ago, so pretty much I feel fine. Mm-hmm. But it does still pop. Is that something that I could benefit from pelvic floor therapy?
I believe so. I work with people.
I did a bar class this morning, mountain climbers. I was doing flutter kicks, pop, pop, pop. It doesn't hurt anymore, but it makes me scared because it used to pop and hurt. Then I had surgery, and now it just pops, which they said is very normal. That's fine.
Yeah. Well, your labrum is responsible for keeping the stability. Like, if this was the socket and this was your hip bone, the one that goes in there, the labrum kind of wraps and kind of goes like holds it in place. So after labral procedure or something like that, yes, it can be improved. But again, you could have some integrity issues with just because it's a repaired thing.
Yeah.
So some of its original integrity might be different.
I should have just got a replacement at 33.
No. You can do that later if need be.
Oh God, I don't want to do it again.
You may not need to. But there are muscles that are responsible for hip rotation that live inside the pelvis. And hands down, one of them is called obturator internus. Tell them that. Obturator internus. It is I try so hard not to be biased and be like, oh, obturator's involved. Anytime I'm doing an internal assessment on anybody, like finding out what muscles are the problem internally. But almost always people are like when I apply pressure on it and move their hip, they're like, that's really painful. And I'm like, that's the thing. So we will fix it. I'll either put needles on the muscle belly and look at your face. Can you draw that? I want you to draw it into your face when you say needling. Yes.
Okay.
This sounds really, I was going to say in a lickety split. Really quickly, people start to feel release of tension in those muscles. So instability in the muscles.
I feel like a lot of that.
Yeah, like it could be because one is holding too much, one is not, which shifts how the whole hip sits in the socket. Mm-hmm. If the muscle that turns the hip out is super tight and the muscle that turns the hip in is loosey-goosey, it doesn't know where midline is and it just kind of goes clunky, clunkety clunk, right?
Yeah.
If you don't use your tummy muscles, ideally, your pelvis isn't stable. Your pelvis is the socket part of your hip. And so if it's not stable, you're going to have issues. So it's like a big onion, and we peel the layers in pelvic PT to figure out what are your specific issues that are contributing to the problems you're experiencing. Which if you're telling me I have instability and another patient comes in and tells me I have pain every time I do doggy style, I might treat it very differently. Right. And it could very well be the same muscle that's problematic.
Yeah, that's interesting. I don't really have pain during sex.
Yeah. And that's a you thing.
Just while walking.
You see? Yeah.
No, not really walking anymore, but like working out in any sense of the
And
word.
So we would just see, what do you do? So as pelvic PTs, we're like investigators of your whole body because everything is connected. And we want to, like, there's people with TMJ in the jaw. And a lot of those people have pelvic floor issues because tight jaw, tight pelvic floor.
Whoa.
Yeah.
Do you know how many people are out there getting Botox for their TMJ?
Yeah.
When they could just be getting pelvic floor therapy?
We could address both because generally speaking, there's things that people are doing that are creating these issues. But where we differ is instead of saying, okay, let's shush it by shushing whatever muscles are making the problem, we go, why is this happening? And we investigate the why. So for the rest of your life, when you start to pick up on things, this must be this being where it's coming from. Instead of it being a situation like, oh, let's just shut it up.
Right.
We are like, no, let's investigate. Let's figure out why this is happening and stop it or manage it.
You're kind of romanticizing pelvic therapy.
Oh,
I don't know if it's your tone of voice or something, but
really?
I'm into it.
Oh, I'm glad I'm into it.
I have to come see you.
Come see me.
My body needs help.
Yeah.
I played volleyball. I stopped. But after surgery, I was like, okay, to go back. I started playing again sand volleyball. So it is a lot of,
diving
work.
And jumping and lifting.
And just even like walking in sand is hard.
Yeah,
right?
it is.
I played for months. And after every single time I played, I would have to come home and ice my hip. It would hurt really bad, like for the next 12 hours. And then it would be back to fine-ish.
Yeah.
My team stopped playing volleyball for the season. And I was like,
were you excited or like, thank God?
No, I was sad because I love it.
Yeah.
My hip hasn't hurt to the point where I have a hard time walking since volleyball stopped.
Okay. Did you know that? But and you picked up on that. You were like, oh yeah. there's a correlation, right?
Yeah.
So then to me, that would tell me like, okay, there's something you're doing. There's a lack of stability. And your therapist is probably an amazing therapist. I believe them because you would not still be, they're not still be in your life, right?
And he's been like, come back to me. Hello,
yes.
I can help you.
Yes.
I'm like, yeah, I will.
And traditionally speaking, most PTs in the orthopedic world that are treating hip issues treat it from the outside.
Mm-hmm.
Pelvic PTs are the only people that also treat it.
He recommended. He's like, you need to get pelvic PT.
And that's why he's a badass.
Yeah.
Because he knows that internally that could be problematic too. And some of those muscles, the way you get to them is inside of the vagina or in the rectum. And if you can't investigate it,
mm-hmm.
because it's not, you can't take an x-ray or an MRI unless it's off of the tendon is off of the bone. It's not going to tell you it's this muscle that's the problem, but we will. And we will be like, this is what you should do differently and
mm-hmm.
correct and give you corrective exercises to help you, manage that, reduce it, or fix it.
Right.
Right. That's the intent.
If somebody, and I'm so sure that this is different for every single person, but if somebody starts to go to pelvic floor physical therapy and starts to see differences
mm-hmm.
and is feeling good,
mm-hmm.
I don't know, let's say at first they're going bi-weekly or
mm-hmm.
something like that. Would you say, like, probably for the rest of your life, though, you should, like, recheck in, like, maintenance?
Oh, that's,
like, once
yes.
I don't know.
A quarter or a year.
Yeah.
Yeah. So that's a really good point because I don't feel like pelvic PT is anything you treat. It's a journey. Mm-hmm. And just like with weight, it goes up, it goes down,
right.
Stress is up. And, we didn't even talk about stress and how that plays a big role because of the autonomic nervous system component to it. Yeah. But I don't know why I said, like I'm Canadian. You did that earlier. I didn't know.
I'm rubbing up on you. Yeah, I said A.
Hey, you said A. I was like, yeah. So it's not really like other thing. Like you had a labral tear, and so they fix the surgery, and then you go for that, and then you're done with PT, right? You should be. It's a journey in that, just like with weight goes up and down based on what's going on in your life. And sometimes you are on the wagon and sometimes you're off the wagon because things are feeling good now. So it's like sex doesn't hurt anymore. I'm working out. I've done all these activities. I stopped doing my stretching routine. And now I think I've made my whole pelvic floor angry again. Mm. And so you might go back, not that you're starting where you started. You're not coming back where you started. You're actually coming back to, I have the foundation and I just need a tune-up because for whatever reason, I did something, I flared it up. I can't seem to use the things that I traditionally do to bring it down. Can you look and see what I need to do? Okay. And then I'll be like, yeah, sure. Let's just, and so do I ever truly ever stop seeing a patient? I would say no. I would say that, like, for instance, I might see you for pain with sex. Now you're pregnant. Mm-hmm. So I might see you for birth prep. Now you had a baby. I might see you for postpartum, post-pregnancy. After post-pregnancy, you might hurt your hip. You have SI joint pain. And now
picking up that damn baby all the time. That car seat and that diaper bag. Exactly.
Now your shoulder's killing you because you did this thing, or your back is flared because your SI joint is unstable because you stopped doing your exercises because mom life. And then I might see you again for your SI joint pain. So it's never gone. Or now you're in perimenopause and
SI joint, is that the same as, what's the?
Your sacroiliac joint.
What's?
Oh, I should have brought my models.
That's a long name. What is the?
Sciatica.
Yes. I was like, what's when people say something, that is that.
So sciatica is the nerve bundle. Your sciatic nerve is the nerve bundle that goes, like if you think of your tail, the bone where your tailbone is, mm-hmm. It kind of weaves through all those muscles and goes down to your leg. Okay. So the sciatica is like the roots on a tree mm-hmm. for all the little like the little tiny nerves that go all the way down to your leg. And they're not tiny, but like it's the big chunk of the big roots. And then they kind of branch out to the leg. And so people that have sciatica, it could be muscles in the butt that are just inflamed, bulky, tender, and compressing on the nerve that goes down your leg, or can be coming from your back. Again, back to peeling the onion to figure out what's your problem, because everybody has to. I have people that I've seen, and I apply pressure internally because sciatica runs through, right? And they're like, "That's the pain I feel with my sciatica." And I'm like, okay, maybe it's not sciatica. Well, maybe it's your pelvic floor muscles that are just so tight around that area. Let's release it. And then they have less pain with that. Like, they're like, that sciatica pain is gone. Well, maybe it wasn't sciatica. Maybe it was your pelvic floor.
Interesting. Okay, let's talk about the stress.
Stress.
So I saw you post this on your story. It was like, where do you hold your stress?
Yeah.
And it really got me thinking, because I think it differs, but for a while it was like in my trap.
Upper trap? Mm-hmm.
What is this called? One time I called this a trapezoid. A trapezius.
Yes.
Is that what it is? Okay.
Yeah.
So my trap, I feel like I do hold stress there, whether it's computer or talking on the phone or looking, whatever. But then there's been some times in my life where like my lower back becomes pretty debilitating. Like I've had to leave. I used to work on my feet and I would have to leave work. And it just, I was like, I don't know what I'm doing. I'm not doing the same thing every time to get this, and it's random times.
Yeah.
So you're saying that is could be stress related.
It could be. Yes. Because when people get stressed, it fires their fight or flight system. Our adrenal glands they like release adrenaline. Adrenaline is our stress hormone, right? So adrenaline being the stress hormone, we get that response of, we have like automatic nerves and then autonomic nerves, or like an autonomic nervous system. It works a little bit differently in that it's firing even if you're not trying to make it fire. It's working even if you're not doing a certain thing. Like you can't turn it on and off. You can, but it's not in the same way that you can turn the system off for like skeletal muscle, like your arm or something like that. So when you have a lot of stress, you fire your fight or flight system in our body, which is like heart rate up, muscles tense, and, and things start to go this way, right?
Right.
Whenever we fire our parasympathetic nervous system, which is you've suppressed that fight or flight, like there's danger. Whenever there's danger, it's going to think about it. If there's a bear that walked in the room, we would immediately be in like major sympathetic nervous system fight or flight. We got to get the heck out of here.
Yeah.
Because something bad's about to happen. Well, when you're always in a stressful, like chronic stress situation, whether that's your work, being a mom, having trauma that you haven't navigated or anything like that, then your body tends to be in that chronic fight or flight. Like there's danger. And many people carry that in their shoulders, pelvic floor, in their jaws, in their neck, in their back. And they don't connect with that system because it's always on. So they just go, my back hurts, my neck hurts, my pelvis is tight. It just always is what it is, right?
That's who I am.
Yeah. That's who I am. But when you fire the parasympathetic nervous system, it's rest and digest. And the pelvic floor, the bladder, uses that to pee. Like I always say parasympathetic, like they have this mnemonic or something that's like point and shoot, right? Like parasympathetic is your erection, right? Point. And then sympathetic nervous system shoot is the ejaculation, right? So meaning you can't, like, those are things that, maybe we could control, but there's a system in our body that kind of takes over there, right? So that's the most like general way I can kind of explain it, where one, the relaxation of vessels is what allows the point to happen. And the highest point peak of like an orgasm, right, is going to apply pressure on the pelvic. The pelvic floor goes up, 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 and that causes like help with ejaculation. Yeah. So it's very complex, but your sympathetic nervous system and parasympathetic nervous system, we're going to work to kind of get that into balance so that you can let go of your pelvic floor muscles, relax those pelvic floor muscles, and also have you navigate what that is like from a stress standpoint so that you can turn off that chronically on system of chronic stress. There's danger. I'm on. I gotta go. So we work on it from a mindfulness standpoint, connecting with your body so you know when it's on and off so you can make the corrections in that moment instead of waiting months, years, weeks and being like, man, my neck is killing me. Yeah. How did I get here? But really, it's probably been happening for like weeks and you didn't pick up, or months or years.
Yeah. It's just interesting that it's just not that common.
What do you mean?
Like that
like,
it's just...
It's not like
that we don't know about it. That people don't recommend it. I mean, obviously it's becoming more and more.
Yeah.
Obviously now, which is great.
Yeah. I mean, honestly, I'm going to be devil's advocate here, right? I really feel like, I mean, this system isn't new, right? But the education around this system historically with our physicians, like physicians do not learn this in school in the same way we learn this in pelvic health. So I'm going to give them credit in the sense like, because most people, when they think I've got a problem, they go see a physician, right?
Right.
And so we put a lot of stress and onus on physicians to do something about the thing.
And to have the answer.
Okay,
fine.
Yeah. So, I mean, I will go ahead and say like, they have many answers? Yes. But we all kind of have niches and spaces that we're more knowledgeable about.
But I'm surprised that I just have only heard of it in my, I guess probably when I was 33 is the first time I heard of your pelvic floor.
Yeah. I mean, I'm not giving excuses.
Yeah.
Things definitely need to change.
Yeah.
Because the problem is our healthcare system is very medicine driven and not corrective or preventative. It's more like reactive.
Yeah, definitely.
So because of that, most times than not, you're going to take medications to suppress the issue.
Okay.
They just shush it because people have things to do and people to see. And then, or they're going to do surgery because people want to fix the problem and be done with it, even though you're never really done with it.
That's true. When I did go in for my hip surgery, they were like, which I guess I had one of the best orthopedic surgeons in, I don't know, not like more than Texas. Yeah. Dr. Harris.
Oh.
Nice. Oh my gosh, Memorial Herman. Yeah.
Okay.
And he was great and everything's great, but they were like, well, let's do physical therapy first. And I was like, I've done physical therapy.
Yeah. You were ready to get out of pain.
I did. That was not a lie. But like, had I done a plan of physical therapy 3 days a week at the place and then on my own, no. But I was like, fix it.
Yeah.
I was sitting in a car and I couldn't get up. And I'm 32. So that's not, you know what I mean? So you do just.
You want it fixed so you can get to life.
You want it fixed. So, but I want to fix, it's fixed. So I just want to keep it going now.
Yeah. And that's fair too.
Progress.
And I think and there are some cases where, like, for instance, with prolapse, where your prolapse is whenever, like, after birth or poor mechanics, the tissue that lives inside the vagina or around the rectum, the muscles can either get weak or the lining can get weak and start pushing tissue outward. Okay. So, like, people go to run and then they feel like they've got like a tampon in between their legs because their tissue is descending out of their vagina.
Yikes.
Yeah, and that happens after birth, and some of that could be in mechanics. It's usually not like not overnight, but in many cases it might feel overnight because now it's so loud that it's got your attention, where before it wasn't so loud and it didn't have your attention. And so we can, in some cases, we can teach you the mechanics so that it's not loud anymore, but we can't necessarily make it go back up. There are tools we can use to make it sit in different spot. And in some cases, it can eventually start resting in that spot because it's used to being there now.
Yeah.
And you know the mechanics to keep it there. But in other cases, like a labral tear that now it's not connected to where it was before, there's like a lining inside the pelvis that connects to the bone. And if that's not connected anymore because of like a birthing trauma, it's pulled off of that bone, you definitely are going to need surgery. I can't fix that. But I can probably help you stabilize that to make sure it doesn't become problematic in the future after you've had surgery.
Right.
So you might have just needed surgery. I don't want you to be like, oh man, I should have just tried therapy.
No. I I believe that I did need surgery.
Oh yeah.
But I also have problems on my left hip, so let's start working on it now.
Yeah, exactly.
I did see, I think it was on your Instagram, talk about endometriosis. And I want to hear more about that, but I also want to know, maybe in the same breath or whatever for you, what about PCOS? Could this be?
Yes.
Okay, tell me.
Yeah. So
I know so many women who have, chronic periods, chronic cramping, crazy bleeding.
Yeah.
Cysts on their ovaries.
Fibroids.
Then PCOS, they have hair growth and weight gain and chronic headaches and things like that. And I'm seeing more people talk about it now, which is great.
That's really good.
But how can pelvic floor therapy help that?
Yeah. So I'm glad you brought this up. There's an aspect of pelvic PT which feels newer from a research standpoint, because honestly, fertility is not a place that people have really studied until I think it was like the late 80s or maybe the late 70s, early 80s, around that time. It's still pretty new from a research standpoint, right? But honestly, a lot of female related diagnoses, like people with a uterus or had to use their ovaries, have experienced that most people just said, oh, well, this is just a cycle, right? So 1 in 10 women has endometriosis. Like that's how common it is. However, it takes about 7 providers or 7 years to be able to get a diagnosis.
Wow.
Why? Because a lot of these things they didn't just show up. They probably already had it when they were like heavy periods when they were a teenager. So they had to miss school because they always had to miss a day of work when they're on their cycle, or it's so debilitating they can't leave the house. They just sit with a heating pad on them and they just contribute that to, I just have really bad cycles. And maybe they don't investigate. Or if they go tell their provider's like, okay, well, let's put you on birth control. They put you on birth control. Now you've reduced, you've changed how the signals are coming off because now you're on birth control. So you're not going through this.
You're kind of shushing or you're moving the direction of it.
You're just shushing it. And so you just think, oh, it's better now, but it's not. And then in some cases, the gold standard for endometriosis, to my knowledge, and I could be incorrect in saying this, but it's excision surgery, meaning to remove the endometrial tissue.
Okay.
To be clear, what endometriosis is when the lining of the uterus starts growing in various areas outside of in the uterus, and it creates scar tissue, pain, and every time that tissue is shedding, the other tissue starts to mimic the same responses, and you get excruciating pain, in some cases heavy bleeding, and people don't really know what it is, and they're like, it just really hurts, and they can't do anything, and they have to experience this sometimes. Usually it's like every month on or around their cycle, they have these debilitating, excruciating symptoms that just stop life. And so they're like, I just need to make this thing stop. But in some cases, so what does pelvic floor do? We don't necessarily treat endometriosis. We address the symptoms associated with it. If you're always in excruciating pain, you're going to guard and protect that area. Your pelvic floor muscles then start getting tighter and more restricted.
Okay.
Abdominal, if you have any endometrial tissue in the abdomen area, they call it endobelly. There's a really good documentary all about endometriosis. I'm hoping to do like a whole video talk on it in next month for Endometriosis Awareness Month. Keep you updated on that.
Yeah.
But the scar tissue gets really restricted in there. People get tight and it's an inflammatory disease. So just think of inflammation in your body in that way. It can impact fertility. It can impact your pelvic floor muscle restriction. It can impact pain with sex. It can cause fatigue. It can cause tight hips, tight back. Like, it's just so many things, but it's so blind. Like, I don't mean it's so blind, but it's not a visible disease.
Right.
Right. It's not a visible disorder where you can't be like, oh, I see why you have that. And it's hidden. And so to navigate that for those people, it is emotionally draining. It's sad. And there needs to be more research on how do we give these women, these people, their lives back while also healing them from the thing that really bothers them.
Right.
PCOS, irregular cycles, it's a shift in the hormones. So for pelvic PT, like I had a person that has, that I saw that had PCOS, right? And we can do mobilization, which is when we move things either in the stomach and the pelvic floor, your organs that live in the pelvis, if you have the right training. And so one of the trainings I've done is for fertility work, right? And so that's really understanding the cycle, hormones, the endocrine system, because that's our hormone system, and trying to impact it in the way that we can within our scope and what we do. So I had a person that had PCOS, and our ovaries in people with a uterus, right? Our ovaries are our hormone, like our reproductive hormone machine, right? If the hormones aren't working ideally, we can move the ovaries to kind of wake up that system, like, oh, I'm so sorry, I've been sitting under a rock, kind of a vibe.
Whoa.
And I had a person that I was working with that had a cycle, like, let's just say it's like April, and the last cycle that they had was in like October of the year before, right? Because they don't usually have they have very irregular cycles. And they told me this, but they were trying to work on can you imagine trying to get pregnant and you haven't had a cycle, you don't know when your cycle is coming, all the things. And I was like, well, let me just try this technique. There's no chemicals in putting your body. It's just moving the ovaries. The very next month she had a cycle after I did it. And she hadn't had a cycle since then.
No way.
I'm not kidding. And so it's like, now it's like, okay, well, we're not necessarily doing anything, like injecting anything to make these things happen. We are just trying to allow the system to work as it's supposed to work.
Incredible.
I had another patient that has been trying to get pregnant for years, and she hasn't. She had endometriosis, all the things, and similar approach for a different reason. The other one wanted a cycle. This one, I just wanted them to maybe see if the ovaries would start to produce progesterone, which is the pregnancy hormone to get you pregnant and keep you pregnant.
Right.
So it's like, maybe we can get the system to start working. I did this technique on her maybe 2-3 times. And she was about to ovulate. So like, well, let's do it before ovulation. So I did the thing to stimulate ovulation and pregnant, and never been able to have a positive pregnancy test. And she's been married years. Oh
my God.
Pain with sex for years. We worked on the pain with sex and then worked on the fertility stuff and pregnant. And it's just like, those are the things that when I say every human should see pelvic PT, these are the reasons why, because there's so many things that people deal with.
I had no idea.
Men with prostatitis, chronic pelvic pain that men have, where they're just like their testicle, they go to bathroom urgency free, go to the bathroom all the time, or it feels like they have prostate issues, prostatitis, and they go in and they're like, your lab values are fine. They're like, well, that's weird. What's going on? If my lab values are fine, how come I'm having all these issues? It could be your pelvic floor, because they sometimes mimic prostate issues, and really it might be your pelvic floor that's the problem. And they tend to navigate it. It takes forever for them to get a diagnosis in some cases too. It's a lot.
It's a lot. Well, it's just like, it just makes me feel for people who have been looking for answers or something like that. And I mean, but hopefully now, hopefully it's just coming more and more talked about and stuff like that. That
they can get the help. There's help out here. There's many pelvic, like if you're in your area and you're like, where do I find a pelvic PT?
Yeah.
Right. The Academy of Pelvic Health is an area that it's for pelvic therapists, and they have a list of therapists that can go to. Another community is women of color or people of color. Sometimes there's a mistrust, there's not a trust in the healthcare system because of years of tests done on Black people, like the Tuskegee test way back when, that might have done lab testing on Black people to trial drugs and medications.
Oh, I'm not
and so
on that.
it's okay. It's all right. I think there's a Tuskegee study is what it was called.
Okay.
Black women are twice, if not three times, as likely to die after childbirth than,
that's terrifying. I have heard that statistic.
Yeah, than white women. And it's just those type of disparities, that really impact Black people being able to, or trusting, their trust in the healthcare system. Not just Black people, but people of color that maybe have cultural backgrounds that, they don't feel like is either heard, listened to when they go into the healthcare field. And there's another pelvic PT out in Chicago. She goes by the vagina rehab doctor. I don't know, Dr. Howell. Okay. And she created a directory for women of color that are pelvic PTs, so that no matter if it's in South Africa, Jamaica, Canada, the US, everywhere for women of color. And that's every color. And it's specific because there's pelvic therapists that are of color. And sometimes people are like, I just want to speak to somebody who looks and thinks like me, or knows my background, or I don't have to feel like I need to explain myself. Right. Yeah. And she created a directory of all pelvic PTs that are women of color in various areas. And that's a place you can go look for a pelvic PT. You can also look on Nicole Cozine. She's a pelvic PT in California. Okay. And she's really known in our field as kind of, I would say she is a, what do you call that thing? Like a trailblazer. She's a trailblazer in our field. The vagina whisperer. There's so many people, even on social media and or in real life.
If you're at a loss, start by Google
pelvic PT.
Or therapy. Instagram keyword pelvic floor therapy.
Yeah.
And I feel like you'll
get
somewhere, but those are great resources. Yeah. I will put them in the show notes. I might ask you
those places.
Yeah, I'll go through this and edit the podcast and listen to it. But if I need help with the names of those people, because I think that those are great resources for people to have, even if it's just watching people on social media and just kind of getting a good handle on what that kind of looks like, or just being introduced.
What's it all about?
Yeah, what's it all about? Yeah. So that's good. Yeah. My God, I just feel like you I'm not scared, but you opened a world that I need to go into. And probably so many people do.
I agree. That's why I say every human, because it's not, and I'm glad you said the word scared, because the first question I always ask people when they come in to see me, I go, are you nervous? And then I said, don't be. We're just going to talk. I just want to just like you were like, I just want to get to know who you are. Yeah. I was like, I just want to know what you've been, like, who are you, what you've been through, because it's all connected.
That's important.
And if we could just peel back the onion, we can maybe finally get you to where you're wanting to be versus where you are right now or where you've been. And so it's not a thing we treat. It's a journey, and it's having you figure out who you are in a way that I would say pelvic PT is the therapy you never knew existed for the symptoms you've never been able to explain.
That's a good cap on it, because I talk a lot about mental therapy, mental health therapy. Go get it. You won't regret it. Yeah. You know?
I agree with that too.
Yeah, but there's just different, like your body, like you only get one body. No matter how many surgeries you end up getting too, it's like you still got to maintain or strengthen or stuff like that. So you can get the quick fixes, you can shush things. Yes. But I think that in a very like non-professional way, I'll say that I feel like it sounds like the more work you put into something gradually and over time, the longer and better outcome it's going to have.
Yeah. It's empowerment. It's like you end up knowing yourself in a way that you haven't in the past. And so then you're less scared. You know what to do. Right. Instead of being like, what is happening to me? It's not happening to you anymore. It's a thing that you're knowledgeable about, and you're like, okay, I know what this thing is. And now this is what I can do about it.
About it.
Yeah.
Okay, what's your wine of the week?
Oh my gosh, my wine of the week is how come providers, I'm really frustrated with the fact that there's many providers out there, even though 1 in 4 women and 16% of men have pelvic floor dysfunctions, they're still not being referred. That's my wine of the week. Actually, I just posted about that today.
That's a good one. 1 in 4 women and 16% of men have pelvic floor dysfunction.
That's 25% of women. If we didn't even,
that's huge.
That's a big chunk of people have pelvic floor dysfunction. 16%, almost 20% of men have pelvic floor dysfunction. Yet they are running around in circles trying to figure out how to fix things. Running around in circles to figure out how to maintain these things.
How do we fix that? You got to get everyone together in one room, one Zoom call.
We come on Adultish Wine.
Spread the word.
You spread the word.
Yes.
You do it on social media.
No, but talking about it and bringing more awareness to it, and even just in conversations, like I've actually said to a friend of mine, she's pees all the time. I'm like, I sent her a video of yours a while ago from when I think I first saw you on the nightcap. She's like, interesting. But like I didn't know anything about it. Yeah. I was like, she's talking about
you
peeing a lot all the time.
Yes. That's you. We all know these people, right?
Yeah. So I think just talking about it and making it more, I don't know. I don't know if it necessarily, it's like a normalized situation, but just like, I don't know, go check it out. Yeah. See what the physical therapist has to say.
Yes. And then at that point, it doesn't have to be like a lifelong thing. It could be a quick, there are some people that are like, I just sneeze and cough. And then like in 2 sessions, they're like, oh, now I get it. Oh, that's all I need to do? Okay, great. Yeah. Thank you for this. And it's not a problem. It's just like, you just weren't doing that first. That's it. Just go do that first. And they're like, no, you push there. It doesn't hurt. No, that doesn't hurt. No, there's no problem. Yeah, I can shrink. You're not weak. You just maybe just didn't do it at the right time. And that might be the reason why you're buying all those Depends for however much money that they're. Yeah. I don't know why I said Depend. Incontinence pads. Whatever you want to call the things.
Incontinence pads.
Yeah, I don't need that company coming from my head.
I tell everyone, like, my podcast is not that big. No worries there. Oh my goodness. Well, I just feel like I got a wealth of information.
Wonderful.
I would love to come see you.
Please do. We're not far from each other.
Just to kind of get like an assessment, what you think, how you think you could potentially help me help myself.
Yes. Oh, I love that you said that. Because we don't fix people.
No,
we
you
help
can't
them
possibly. Like, and especially like,
yeah.
I mean, you could help. You have to. I have to learn.
Yeah.
How to.
We just help you help yourself.
Things. Yeah.
Mm-hmm.
Okay. Well, I'm gonna see you.
All right.
Maybe we'll video record it. Am I 90?
Maybe
I'll get out the old video recorder.
I love it.
Maybe I'll take a video.
Okay.
A whole video and just kind of like, because obviously I'll just share everything.
I love it. And I think that would be great.
Yeah. Okay. Where can we find you? And I'll put it in the show notes as well as the other resources that you mentioned. But
all right.
Where are your social media handles?
Yeah.
Where can we find you?
So you can find me. I'm historically on Instagram. That's my place of choice.
Okay. Mine too.
Yeah. At Dr. Mamawah Bourque. And you can also find content that our team have a new therapist that has joined our team because there's just so many people that need help in Houston.
Fun. Yeah. That's great.
At Awareness Pelvic Health.
Okay.
I'm here in the Heights area.
Which we love the Heights area.
That's great. And have a practice where we treat one-on-one. You can also go on my website, www.awarenespelvichealth.com.
Okay.
I have a blog. I also, on the site, the Pelvic Toolbox. And I don't have a lot of content on there right now, but if you tell me what you want to know, I might just write it.
Okay, perfect. Well, I love it. Well, thank you for coming.
Thanks for having me. This was great. I could talk about this all. Yeah.
I could talk, like, I need to talk about it more, but I am like, whoo.
Yeah, it's a lot. It's a lot of information.
Yeah, and I'm honestly, like, in the back of my head, I'm just thinking of, like, so many things that I feel like could be helped with addressing this.
Yeah.
So it's kind of, like, mentally overwhelming.
Yeah.
But don't be overwhelmed.
Don't be. It can get better. I promise.
It gets better. Okay, well, cheers.
Cheers.
And it was a good recommendation, Sauvignon Blanc.
Ooh, this one was really good.
Yeah, I think it's Justin from California.
Justin?
I think it's Justin the brand, or Joel Gott. I don't remember. Joel Gott?
That's so funny. Literally your nails and now Joel Gott is literally the two things that have happened this week.
When you see things or hear things.
I hadn't heard of Joel Gott, and this week it's been like, Joel Gott.
I like
three
Joel
times. So
we like Joel Gott.
We do.
It's like an affordable.
You should get it.
We also like Just Enough Wines.
Yes, we do. Just Enough Wines is delicious.
They're really good. Okay, well, thank you again for coming.
Thank you for having
Whiners, I hope you learned some stuff. If you have questions, reach out.
Yes.
I'll put her information in the show notes, and I'll let you know how my journey goes because I'm actually really going to come see you. So, love you guys, and I'll see you next Thursday. Bye.